Non-alcoholic fatty liver disease, also known as NAFLD, has been on a worldwide rise in recent years and is currently affecting 25% of adults globally. NAFLD is a group of conditions caused by a buildup of fat in the liver. There are different stages to this disease, and if it is left untreated, it will eventually lead to irreversible damage and liver failure. There are rarely symptoms early on, and the disease must progress further before the individual may feel stomach pain, weakness, or lack of energy. Patients with NAFLD are found to have higher levels of CD4 positive T cells in their liver, and these cells are associated highly with the human immune system. The main cause of NAFLD is a consistent high fat and calorie diet with a lack of exercise, and is seen for its association with diabetes and obesity. Given that there is no established treatment, it is believed NAFLD may become one of the major health issues within the next few years.
Sufficient nutrition is required for all cells in the human body to function properly. The immune system, when activated, requires a lot of energy, and the demand for energy to power the immune system can be achieved through a nutritious diet in order to provide an effective immune system. The immune system is our very own defence system against viruses, bacteria, and any infections. One of its main roles in reducing chronic inflammation, which is prevalent in NAFLD. When there is not enough nutrition in the diet, the immune system does not have the resources to work effectively, and the body is more prone to illness.
So what actually happened in the study? In this study, HIL mice were used as they were engrafted with human immune cells and therefore have a model of a functioning human immune system. This allows the results to be comparable to what a human study would show without having to use human subjects. The mice were split into two groups. One group was fed a regular grain-based chow diet and normal drinking water to simulate a healthy diet. The other group was fed a high-fat and calorie diet and given water with added sugars to simulate an unhealthy diet. The mice were observed for 20 weeks and compared to see how the different diets would impact the health and the progression to non-alcoholic fatty liver disease in the mice. The immune cells were also analysed to determine how the immune system impacted the progression of NAFLD.
After 20 weeks, the mice with the HF-HC diet had an accumulation of abdominal fat and damages to the liver, such as scarring, swelling, and discoloration. Further dissections of the liver showed similar conditions to stage 2 fibrosis in humans, NASH, which is a more severe form of NAFLD, where the liver has become inflamed, and this affects around 5% of people in the UK. Blood glucose levels were not significantly different between the two groups. However, the HF-HC fed mice had a high plasma insulin level. High plasma insulin levels are the most associated with coronary heart disease in adults. The percentage of peripheral CD4 T cells also increased significantly in the HF-HC fed mice. CD4 positive T cells are important drivers of inflammation. The mice fed with chow diets had low levels of immune cells in the liver, whereas the HF-HC group had a significant increase of CD4 positive T cells, as well as other immune cells in the liver. These results concluded that HF-HC fed mice had a higher NAFLD score and associated liver disease than the chow fed mice. The high-fat, high-calorie diet was extremely detrimental to the mice and caused a lot of medical problems. This study on the mice with human immune cells indicates the same results are applicable to individuals who consume a high-fat diet.
So what inflammatory cells were involved? The study has shown that CD4 positive T cells play a key role in promoting liver steatosis and fibrosis progression, which contributes to NAFLD. The group of mice fed with the HF-HC diet showed a significant increase in CD4 positive T cell prevalence, particularly in fibrotic areas of the liver, whereas the chow-fed mice saw no increase. Although we need CD4 positive T cells to help defend against disease, excessive production can result in mass inflammation, which is dangerous to the body. This inflammation promotes liver steatosis and fibrosis progression, which will contribute to the progression of NAFLD.
The main risk associated with NAFLD is the high possibility of its progression to non-alcoholic steatohepatitis, NASH, a disease involving severe symptoms which include inflammation and fibrosis. Once NAFLD has progressed to NASH, it is irreversible and can be fatal due to the increased risk of developing cirrhosis of the liver and HCC. Since there is currently no drug therapy for the treatment of NAFLD and associated diseases such as obesity and diabetes, have reached epidemic levels, there is a high potential risk of the disease becoming a major burden on the healthcare system. However, if NAFLD is identified and diagnosed quickly, the disease can be reversed by adopting a healthier diet and lifestyle before it can progress to NASH. It has been shown that NAFLD has been associated with an increased risk in COVID-19. The trial supports that an unhealthy diet can compromise the immune system. Thus, it is important to sustain a balanced diet in order to maintain a healthy immune system, which is able to protect you against disease.